The recent business depression kept the doctors on the run because every form of negative thinking may cause ill health. Disappointments in business and in love stand at the head of the list of cause for the fear of ill health. A young man suffered disappointment in love, which sent him into a hospital. For months, he hovered between life and death. A specialist in suggestive therapeutics was called in. The specialist changed the nurses, placing him in charge of a very charming young woman who began by prearrangement with the doctor to make love to him the very first day of her arrival. When she came there on the very first day of her arrival on the job, she made such an arrangement with the consent of the doctor. Within 3 weeks, the patient was discharged from the hospital, although still suffering, but with an entirely different malady. He was in love again. The remedy was a hoax, but the patient and the nurse were later married. Both are in good health, and at the time of this writing, they are enjoying great lives for themselves. Well, as we have already talked about the symptoms of the fear of poverty, later we talked about the fear of criticism, and now it is time to talk about the symptoms of the fear of ill health. We do draw them on the same pattern as we had it for the symptoms of fear of poverty and the symptoms of fear of criticism. Now we go for the symptoms of the fear of ill health. Well, the symptoms of this almost universal fear are: number 1, autosuggestion. Number 2, hypochondria. Number 3, exercise. Number 4, susceptibility. Number 5, self-coddling. Number 6, intemperance. Well, we're going to talk about these 6 symptoms, and they certainly play their own roles in developing the fear of ill health. And we can judge it, we can know about it, we can find them just by these symptoms. Let's talk about the first system, which is autosuggestion. The habit of negative use of self-suggestion by looking for and expecting to find the symptoms of all kinds of disease, enjoying imaginative illness and speaking of it as being real, the habit of trying all fads and isms recommended by others and having the therapeutic value, talking to the others of operations, accidents, and other forms of illnesses, experimenting with the diet, physical exercise reducing systems without professional guidance, trying home remedies, patent medicines, and quack remedies. Well, of course, when they go for those quack remedies, they are not the qualified remedies, and usually they put the patients on stake, and what happens? They don't cure the first disease and they fall into many other diseases.